Good morning and welcome to the weekly COVID-19 media briefing. I'm Kerri Schuette, the Public Information Officer for the Shasta County Health and Human Services Agency. We'll start as we always do with the numbers. Our total confirmed cases are at 10,950. We had a total of 41 cases on Sunday and Monday. We have a total of 21 people who are in the hospital, including 3 who are in the intensive care unit. We have an available regional ICU capacity of about 33.6%. That number is updated weekly by the state, and it was updated yesterday. And we have had a total of 172 Shasta County residents who have died from COVID. Today with us, we have Robin Schurig. She's the director of the public health branch of the Health and Human Services Agency. This is going to be a long morning if I can't get my words to come out. And then we have Dr. Ramstrom, who's the Shasta County Health Officer. We have Glenn Hayward from the Redding Rancheria and Mark Mitchelson from Shasta Regional Medical Center. Thank you everyone for being here. Robin, would you like to start us off with anything this morning?
Yes, I would. Thank you. Good morning. So I have good news to share this morning. If you haven't already heard it, Shasta County is in the red tier. It went into effect at midnight last night, so today. Our case rate is currently at 10 daily cases per 100,000. This is still in the purple tier. It would have to be 7 or less to qualify for the red, but we qualify for the red tier because both our test positivity and our equity metric are in the orange. Our test positivity is currently at 3.3% and our equity metric is at 2.4%. As long as they both stay below 5% and our case rate continues to decrease, we will stay in the red even if our case rate is still in the purple. And if our case rate drops to 7 or below, then we will continue to qualify for the red tier even if our test positivity is as high as 8%. The main differences between the purple and red tiers are that in the red, certain sectors that were not allowed to operate indoors in the purple are now allowed to operate indoors up to a certain capacity limitation. For restaurants, movie theaters, museums, zoos, and aquariums, it's 25% capacity. For gyms and fitness centers, it's 10% capacity. And then the retail sector, which was already allowed to operate indoors, will now be able to increase their capacity from 25% to 50%. This also opens up more sports that can be played recreationally, although it doesn't change professional or collegiate sports. Another change is that higher education will now be allowed to hold in-person lectures, but must limit their capacity to 25% or 100 people, whichever is fewer. They were already allowed to be in person for essential programs like nursing, fire, and law, and for subjects that can't be taught virtually, such as welding, for example. But other subjects will now be allowed in person as well. I also just want to provide a reminder that this is not the time to let our guard down. We don't want to end up right back in the purple, and we don't want to see a surge in cases followed by hospitalizations and deaths. There are several more infectious strains of the virus circulating in various parts of the world, and several of them have already made their way to California. It is predicted that the variant from the UK will become the dominant strain in California by sometime in March. When this variant arrives here in Shasta County, because it is more infectious, it will infect more people than the current strains that are circulating, so it will cause our case rate to increase. There's more and more evidence coming out about some people, including many who only had mild illness, suffering long-lasting effects, the condition that has been coined long haul or long COVID. And whenever there is an increase in cases, it is followed by an increase in hospitalizations and deaths. So this knowledge, combined with the fact that there is a limited supply of vaccine, which prevents us from being able to protect people before these variants arrive, serves as a good reminder that while more things are allowed to be open, we still need to continue our masking and distancing, stay home when we're sick, and get tested. The more people who get tested, either because they have symptoms or have been exposed to someone who's tested positive, or because they interact with people on a regular basis as part of their job or for some other reason, and therefore get tested on a regular basis, the better picture we will have of how much COVID is present in our community and when these variants arrive, and the better able we will be to contain the spread. That's all I have for this morning, and I will turn it over to Dr. Ramstrom.
All right, good morning, everybody. So I was going to provide primarily an update on vaccination, the COVID-19 vaccination efforts this morning. Our biggest challenge continues to be a limited and unpredictable supply of vaccine, which makes it challenging to plan our clinics, which really ends. That's how we receive our allocations. The good news is that the vaccine supply is very slowly increasing, and we're making progress in getting our eligible high-risk groups vaccinated. So that's all very good. In an effort to reach those high-risk groups, many of those clinics are happening by invitation, which means they may not be visible to the public, and we understand that that can be frustrating and hard to know what's going on. But just to explain that that's partly why it's not like you can go on our website and see where all the clinics are. It's because we're working with certain groups or reaching out to certain individuals who meet these high-risk priority group categories, and that they have, and some of them have been reached out to in response to their signing up at shastaready.org on the vaccine page. There's a blue button, and especially for these groups that we're trying to outreach right now to, we recommend that you sign up on our website, and when your name comes up, we will be reaching out and letting you know where you can get vaccinated. In terms of our numbers, we have been allocated about 30,000 doses or so. We've received, actually I don't have what we received some yesterday that I don't have in these numbers. These were vaccines that were delayed because of the weather in the Midwest last week. But before it, whatever that was, it's about probably 2,500 doses. We have 22,000 doses that we've received so far, and we're pushing those out every single week. And so that gives you an idea about how many people we vaccinated. The expectation is we receive the vaccine allocations on Sunday and Tuesday from the state. Within we order them that week. They come early the next week, and we work with our community vaccine providers to use that vaccine over the following week. And so the vaccine is being pushed out and used to these high-risk priority populations very quickly. We're continuing to work with about a dozen vaccine providers countywide, and some of those those providers are vaccinating their own patients. Many of them have also worked in partnership with us to adopt certain groups that are in the eligible category. So we're really very thankful for that. And across the county, we're making progress in getting our vulnerable populations vaccinated, but we still have a lot of work to do based just on our limited vaccine supply. So who is eligible right now? Who have you been working to get vaccinated? We're continuing to work on the make available vaccine to the previously eligible groups, including healthcare personnel. Our long-term care facilities are continuing to be vaccinated, and they're scheduled through the spring with the Federal Pharmacy Partnership Program. We are working with those facilities that aren't in that program to get those individuals vaccinated, residents and staff. We are also focused on individuals 65 and older, emergency services, and educators in childcare. We've made really good progress on our K through 12 and childcare staff. I think we have one clinic left to do first doses for all of those individuals who are interested at this time. And we're starting to plan really seriously for food and ag to start at the beginning of March. So more to come on that. It's probably going to start in East County initially, and then we'll roll it out to the rest of the county, probably in different groups over time. It's a large group. It's over 7,000 people countywide. So again, we encourage you to go to shastaready.org and click on the blue oval titled "Tell Me When It's My Turn" and complete that survey, and you'll be on our list. And again, if you're not among our eligible groups, it could be quite some time before we outreach to you. And that's all I had today, but happy to answer any questions.
All right, thank you, Dr. Ramstrom. I wanted to add that the state also has a sign-up system called My Turn. Right now, that is not fully functional in Shasta County. So if you have not signed up through our link that goes to our survey, it's got a big image of the Shasta County HHSA logo in the back. That's the one that's going to get you on our list. So if you have filled out a different survey, please go back to our website and fill out the Shasta County survey. That's going to get you where you need to go a lot quicker. All
And
right.
Kerri, I did have one more thing to say, just in response to some questions we've been getting. Just a reminder that the Pfizer and Moderna vaccines are safe and they're highly effective against serious illness from COVID-19. And the growing data and evidence indicate that it also prevents spread of this virus. So we highly recommend people get vaccinated when their turn comes up. And that vaccine is one tool in our toolbox, right? We're so excited to be able to have this available in our community. It's going to help us to get out of the other side of this pandemic. But with the emergence of variants, as Robin was saying, it's more important than ever that we layer all of these prevention measures to maximize the benefit in our community, whether it's vaccine, masking, physical distancing, avoiding gatherings, especially indoors. All of those recommendations that we've had in place for quite some time. Thank you.
All right. Glenn or Mark, do you have anything that you would like to start us out with this morning?
Yeah, Glenn, you want to go first? I'll go after.
After you, Mark.
Sounds good. Thank you. Just reiterating, I know there was a news article about this yesterday, but we are back open to one visitor per patient at this time, and I think it's going very well. We really do want to kind of get back to a sense of norm and make sure our patients have the loved ones near them to help them with decision making and just all the planning that goes into leaving our hospital. So that's going very well, and I appreciate the community to be very supportive with us on that. The vaccine clinics are still going on very well here. After today's numbers, I think we'll be up to about 5,500 vaccines that have been given from SRMC to the public, when I know the public also has been very gracious and cooperative when the lines have been out the door, but we get them in and out very quickly, so it's been nice to see. Otherwise, yeah, we're just hoping that we just continue to see a drop in case rate and go from there.
So that we are looking forward to March 13th. We are actually, after the end of this week, we'll have vaccinated the majority of all of our tribal health patients. And so we're about 75% of our patients have all been vaccinated. We're getting a very steady supply of vaccines every week from Indian Health Services. So we're going to hold our first mass vaccination event on the 13th, and we're going to start opening up to 1,000 vaccines to the general public. Anybody 18 and over will be able to use this site, and we're just going to start sharing these vaccines that we're getting from Indian Health Services. They've been very gracious and let us, as long as we're taking care of our native patients, we can use any excess for the general public. So we plan to start giving out those vaccines to the general public on March 13th. So that'll be rolling out Monday with some advertising and a number that people can call to get registered for that vaccine event. So we're looking forward to be able to help as much as we can.
All right, thank you very much. And if you send me that information, we'll also get it on Shasta Ready. So kind of our little one-stop shop there. All right, I think we are ready for media questions. Who has questions for us this morning?
Hi there, this is Matt at the Record Searchlight. I wanted to ask about the vaccine supply. You had mentioned, or Dr. Ramstrom had mentioned, the places we're getting it. I wondered, it goes to public health. It also goes to the CDC for the pharmacy partnership, and then we also have tribal groups getting vaccines. Are those the three main sort of avenues the county gets its vaccine through? Are there others, or are those the three main ones, and which of those are the ones we're getting the most vaccine through now?
I know, it's pretty confusing. So the vaccine we're getting at the county is one pot, and that's the numbers that I've been reporting on. And that's probably our largest supply, and that we're using with vaccine providers. Like I said, about a dozen vaccine providers that have been approved by the state and that we are allocating vaccine to. And then in addition to that, as Glenn mentioned, so there's Indian Health Service vaccine coming, and Pitt River's managing that and making it available to our tribal members and others, as Glenn just mentioned, which is great. And in addition, the VA clinic has a vaccine supply, and they're vaccinating their patients. So those are our different pots. The Federal Pharmacy Partnership Program is vaccine that is taken off the top of the California allocation from CDC. And so it's used to vaccinate in our community, but it is doesn't take away from our county allocation.
Gotcha. Thank you.
Other media questions? I have a list from Anna, if nobody else who's live here has anything. Oh,
sorry. I just had two other. I might as well ask them real quick. Do we know what percentage of our population has gotten its first dose and what percent has gotten its second in terms of the county's population?
So I can't break it up by first and second doses, but I can tell you, and as I said, we have been allocated about 30,000 doses, and that's probably based on what we this delayed shipment based on the weather. I think we got it in either this morning or yesterday afternoon. We're close to 30,000 vaccines, and like I said, we push it out every week, and so that's a combination of first and second doses. And then on top of that, it would be what is coming through the Indian Health Service and the VA. So we're in the process, Matt, of trying to better understand our immunization registry data. It seems to be a little bit delayed, and we're trying to figure out why. And so our epidemiologists are looking into that, and we're hoping soon to have more of those kinds of details to be able to share with you.
Thank you.
Hi, this is Eric Newman from Jefferson Public Radio. I have a quick question just about case numbers. I was wondering, just based on the current case rates right now, what can you tell about the coming weeks and whether this sort of is part of an overall downward trend that's being seen, or if Shasta County has just kind of like dipped below the threshold for the purple tier?
So I think it is part of a downward trend that we're seeing all across the state. Case rates are down in general, along with, hospitalization numbers and deaths. But with these more infectious variants coming, we don't know how long it's going to stay this low. So we really need to, as I said, maintain our distancing and masking and everything, because it could go right back up again in the coming weeks.
Thanks a lot.
I had a question for Dr. Ramstrom about the vaccine clinics. I have heard just a few stories about people who might not be eligible for the vaccine, but they go to the clinic and then they sort of hang out. And then sometimes in the last 30 minutes of the day, a clinic will, will have some left over and want to give it to them, even if they're not eligible. What's your advice for clinics in that position? Should they be trying to make use of that and giving it to people who fall outside the guidelines, or what should they be doing?
Yeah, so we have weekly calls with our vaccine providers, and that end of the day few doses has been a challenge from the very beginning. And so over time, I think we've gotten better, all of us, at maintaining a list of having a plan for the end of the day of who you might reach out to, and having a list that would be based on the eligible groups. And so I think we're getting better and better at doing that. But I do know there's circumstances where maybe that list wasn't long enough, or they weren't available. And so rather than waste vaccine, it's possible it could have been used on a group that's not eligible. That's not the practice that we're trying to put forward. And so we're continuing, all of us, to continue to work on those practices so that we're using that for the highest risk groups, but it could have happened for sure.
Gotcha. So the way to get around it is by coming up with like a list of people you might want to reach out to at the end of the day.
Yeah, absolutely. Yep.
Gotcha. Thanks.
Okay, other media questions? I've got a few from Anna. Anna Cherea from Action News Now. Have the hospitals started already implementing their new visitor policies this week? And Mark already answered, yes, they have. Are the new changes in policies because of the county numbers heading down? And I think Mark said yes to that as well. Did the red tier changes go into effect today? Yes, they did. They went into effect at midnight. What can we do to help keep our numbers going down? We want to keep our numbers going down by continuing all of those practices that we have been talking about for the past year: wearing your mask, physically distancing, staying home when you're sick, getting tested. We've got, you can go and get tested at one of our state testing sites, either by appointment, or you can just walk right up and be tested. And of course, getting vaccinated when it is your turn. Those are all things that especially layered together can help keep our numbers going down. Are Shasta County's numbers looking like they're headed in a good downward direction? I'm thinking yes, right, Robin and Dr. Ramstrom? I'm seeing yes.
Yeah, like I said, that's the trend we've seen so far, and we'll see if that holds once the new variants find their way to Shasta County.
Okay, great, thank you. Are more vaccine clinics planned for this week? Shasta County Public Health does have a second dose Moderna clinic happening this Saturday, and you can find out details about additional upcoming clinics at shastaready.org if you click on vaccinations. And then Mark also mentioned that Shasta Regional also does some clinics as well that you can learn about on their website. Yes, on your website? Yeah, okay.
Yes, and just highlighting that this week's injections are all second injection Pfizer vaccines from people who have previously gotten them. So we don't have any new injection clinics for this week. It would be taking appointments for next week.
Perfect. Thank you very much for that clarification. Okay, the FDA says the Johnson & Johnson vaccine is safe and effective. If approved for emergency use, would Shasta County be able to receive those vaccines?
Yeah, so the FDA is meeting tomorrow, I believe, to make that determination. And then my understanding is it would that vaccine supply would be distributed similar to the vaccine that we're receiving now. We haven't heard any details about that from the state yet, but I anticipate that that's what's going to happen, and we'll keep you informed as we learn more.
All right. Thank you. And then finally, is the county still seeing a delay in vaccine shipment?
So I'm not sure what that's exactly referring to. We receive allocations, like I said, second doses on Sunday and first doses on Tuesday. Our vaccine coordinators order that vaccine, and it comes either later that week or the following week, either to us at Public Health or it goes directly to our vaccine providers. We have not had, and so that's pretty routine. We did have a delay over the last 10 days or so with vaccine shipments from the Midwest, which is where the vaccine's coming from because of the weather. And those vaccine supplies are now being received.
All right, great. And that is the end of her questions. Thank you very much. Everybody have a safe and healthy day.